Myself, Dr.Laxmi. I am talking about Causticum, second BHMS, first term CBDC drug. Objective is to know the prover of the drug, its common name, source and preparation of the drug, its sphere of action and pathogenesis, the causative factors and modalities, the general characteristic and particular features of the drug, and its relationship. Causticum is proved by Dr. Henneman. It belongs to the mineral kingdom. It is obtained by distilling a solution of slaked lime CaOH2 and a solution of potassium sulfate. Common name is Tinctura acris sine and Kali potassium hydrate. Causticum has a very interesting history. It was first mentioned in Fragmenta de Viribus in 1805 as acris tinctura, in which 30 symptoms were published. In Materia Medica Pura, first and second edition, it was published under the name of Tinctura acris sine Kali, where 307 symptoms were mentioned, in which more than 100 observations were of Dr. Henneman. Later, it was mentioned as causticum in chronic disease in 1830, where 1014 symptoms were mentioned. However, causticum is not included in the third edition of Materia Medica Pura. Causticum predominantly affects the central nervous system, in which the spinal cord, the motor tract is affected, which results in paralysis. It affects the medulla oblongata, the pneumogastric nerve, the 10th cranial nerve, which affects the heart rate, the blood pressure, respiration, and the GIT functions. It also affects the mucous membrane, where it causes catarrhal inflammation, which affects the respiratory system. It causes congestion of the kidneys, which results in increase in urea. Causticum is indicated in dark hair, rigid fiber individuals with dirty skin, swollen hard abdomen, emaciation in face with wrinkled forehead, and sensitive right triggers, especially before the right facial palsy. This is a very important concomitant which we will repeat again while discussing or while talking the CNS affections. They are awkward while walking, they often stumble while walking. They have a scrofulous diathesis and they lean on right side while talking or standing. In children, we will find delicate sensitive skin prone to intertrigo, particularly during dentition. Also, it is seen that they have convergence with eruption of teeth. Bedwetting in first part of sleep is also another characteristic feature of children of causticum. Causticum are thermally chilly. Miasm of causticum predominantly will see sora, psychotic as well as syphilitic. We will see these miasmatic traits as we discuss the particulars. Amongst the causative factors of causticum, long-lasting grief is an important causative factor. The other causative factors are suppressed emotions, eruptions, exposure to dry cold air, wind, draft, change of weather, from loss of sleep, night watching, and even the complaints start after a long lasting disease like typhoid, diphtheria. Pain of causticum has a gradual onset. Causticum complaints are often right sided. There is a characteristic pain in causticum. There is tearing, drawing, burning pain with rawness and soreness. This rawness and soreness accompanies all the pain of causticum. The modalities of causticum, the aggravating factors are change of weather, clear fine weather, getting wet, dry cold air, winds, drafts of cold air, thinking of complaints, particularly the hemorrhoids are aggravated on thinking of complaints. The ameliorating factors are from exposure to damp wet weather, rainy season, warmth, gentle motion, and by cold drinks. It is often said that causticums are aggravated in clear fine weather. That means they will have complaints in summers, but many of the causticums who need causticum remedy will not have any complaints in rainy season. Causticum has great mental symptoms. Causticum is sensitive in nature. This sensitive nature of causticum makes him caring, sympathetic, responsible, idealistic, and honest individuals. They are emotionally nervous. When they get excited, they often stammer or bite the inside of the cheek. They can't bear the loss of loved ones. And hence the important causative factor that we see in causticum is long lasting silent grief. This causes lot of weakness in causticum, this long lasting grief. The weakness is manifested at mentals as well as at physical level. At mentals level, you'll find that they become sad, melancholic, they can't bear stress, they start weeping, they even develop OCDs or obsessive compulsive disorders. In physicals, you'll find the weakness is manifested through degenerative changes of spinal cord, which results in multiple sclerosis and resulting into progressive paralysis. Causticum are known to be fair persons in all the things that they deal with. They can't tolerate justice, and at times, because of this, they may turn rebellious. They are also fearful, and hence we see that causticum has fear of ghosts and dogs. Causticum is known to have multiple sclerotic changes in the central nervous system. It causes paralysis of single parts, like paralysis of vocal organs or pharyngeal muscles, resulting in aphonia, paralysis of tongue, esophagus, causing dysphagia, paralysis of eyelids, causing drooping or ptosis. There is muscle dystrophy along with muscle degenerative changes seen in causticum. Causticum has right sided hemiplegia. It also has paralysis of the bladder or the sphincter, which results into involuntary urination, particularly while coughing, laughing, and talking. It has paralysis of sphincter ani, which causes involuntary passes of flatus and feces. There is right sided facial palsy with sensitive right tragus. This is an important concomitant which is seen along with the right side facial palsy. Skin of causticum shows psychotic manifestations like warts. There are large, jagged, pedunculated warts. They bleed easily and they exude moisture. The warts are commonly seen all over the body, particularly on tips of fingers or close to the nails, eyelids, face, nose, and edges of eyelids. We also see dirty skin in causticum. There is also a history in causticum of never well since that particular burn. Cicatrices or old injuries open up easily in causticum, especially burns. They open up and they get infected in causticum. Causticum has white coated tongue with red streak in center and a greasy taste in the mouth. They have aversion for sweets. They crave for salt and meat, but meat disagrees in causticum. There is a sensation of ball rising in the throat, and yawning is an important concomitant with all complaints of GIT in causticum. Causticum is known to have constipation, where we see that there is a frequent ineffectual urge to pass stools with straining. They are able to pass stools better in standing position. The stools are hard, shining like grease. Constipation in children with nocturnal enuresis is also observed in causticum. This constipation results into hemorrhoids which are hard, painful, sensitive to touch with prolapse rectum. There is marked rawness and soreness. With rectal prolapse is aggravated on coughing. Fistula and large piles are also seen in causticum. Causticum is indicated in chronic rheumatic and arthritic affections. Pains are drawing, tearing, burning with rawness, soreness, and restlessness. It is indicated in left sided sciatica with numbness, carpal tunnel syndrome with contraction of flexor tendons, especially when the limb is in cast. In the joint affection, we see the knees are affected where there is cracking with stiffness in the hollow. It is also indicated in arthritis deformans, a chronic arthritis state with marked deformation of affected joints. It was also seen in weak ankles where there is unsteady walking and falling easily. This results from tension and shortening of muscles. In the arthritic complaints, they must move constantly, but motion doesn't give much relief. There is also stiffness of neck and back seen in causticum, which is aggravated from rising from sitting position. There are cramps in calves, feet, toes, and tendo Achilles. The complaints are aggravated by walking and descending and on sitting for a long time. In the female complaints, we have uterine inertia during labor. The menses cease at night and flow only during the daytime, which is opposite of magnesium carbonate. This is an important keynote feature of causticum, that menses cease at night and flows only during the daytime. The menses are too early, too feeble, or delayed. Leukorrhea at night with weakness is also seen in causticum. In remedy relationship of causticum, we see that causticum antidotes the paralysis from lead poisoning. It is complementary to carboveg and petroselinum. We can compare causticum with rustox, arsenic, and ammonium phosphorus in facial paralysis. Causticum does not agree with phosphorus. The remedies should not be used after each other. Diphtherotoxin follows causticum, particularly in chronic bronchitis.